Right. Our next paper is going to be Ileal Conduit versus continent urinary diversion in radical cystectomy, a retrospective cohort study of 30-day complications, readmissions, and mortality. So this paper's background is really the fact that these authors noted about 90% of patients who are having a radical cystectomy would get an ileal conduit urinary diversion. And the authors really observed that this rate had been kind of rising in predominance over the course of their practice. This seemed to be attributable to the growing knowledge that while long-term quality of life is said to be somewhat higher for those with continent urinary diversion, the early postoperative period is often very challenging. And for this reason, I think many providers were not pushing patients towards this option. Then this paper came out, and it's a paper by Brown et al. Called Systematic Review and Meta-Analysis of Long-Term Outcomes of Ileal Conduit and Orthotopic Neobladder Urinary Diversion. And this paper claimed that basically the following or the previous was a misconception. What this was a meta-analysis looking at 32 publications with 47,000 patients, so almost 40,000 that had undergone ileal conduit and about 10,000 that had orthotopic neobladders. And this is not our paper for Journal Club, but this paper is kind of the reason why our group did the research that they did. And so I think it's worth taking a second to go through what their findings were claimed to be. And these are those findings kind of summarized. They compared ileal conduit versus orthotopic neobladders from that meta-analysis. And they found that the overall morbidity was actually there was greater with ileal conduits compared to neobladders with a small but significant odds ratio of 1.16. If you broke these down by Clady and Dindo, their findings basically said that more severe complications were more likely to occur with ileal conduits compared to neobladders, which I think is the opposite of what most of us and most people in the field at the time would think. They saw a quite significant increased rate of mortality with ileal conduits compared to neobladders. I do think this one is really hard to interpret. So one factor is that the definitions and follow-up and duration of study for each of these was very, very different between the different papers that were involved in the meta-analysis. I also think we can make an argument that individuals who are getting conduits may have more advanced disease, may have more comorbidities, are less kind of favorable and less robust in general, and will be more likely to pass away within some duration after their surgery. But without knowing those durations, it's tough to read into it. They did say that neobladders had a slightly longer length of stay at about 19 days, but I would suggest that the 18 days they're citing for ileal conduits is also very high, based on at least our experience. And then they did see kind of higher rates of metabolic change and stone disease in orthotopic neobladders. And their kind of takeaway from their conclusion of their research was that our results show that there's no significant increased morbidity with orthotopic neobladder compared to ileal conduits, and that selection of either urinary diversion technique should be really based on factors such as tumor stage, comorbidities, surgical experience, and patient acceptance of postoperative sequelae. This kind of brings us to the work of our group, or the paper that we're actually discussing today for Journal Club. The purpose of this paper was really to set out and see whether these dubious findings from this meta-analysis were actually valid in a single large sample size cohort. And so what Rezaee did is they took all patients over 18 in the ACS NSQIP database who had a radical cystectomy in 2019 to 2020. And they divided these based on the recorded CPT codes into whether they underwent continent diversion or an ileal conduit. And it's important to notice here that the continent diversion CPT code actually doesn't specify whether it's neobladder or a different cutaneous reservoir. And so those are both kind of combined in that category. They then looked between these two groups at a number of 30-day outcomes. And so again, this time now they're kind of setting a defined postoperative period of 30 days. They first quantified the complications or the risk of complication in these patients. And it was a kind of a wide swath here. And so surgical site infections, wound dehiscence, DVT, PE, other systemic things like stroke, MI, cardiac arrest, sepsis, pneumonia, C. diff, whether or not they had blood transfusions, and then more specifically kind of anastomotic leaks or ureteral obstruction. They also looked at the rates of unplanned operations in the first 30 days after surgery, all-cause readmissions, and mortality. And these are the kind of the start of some of their summary statistics. And so they managed to study 4,755 patients who had a radical cystectomy. Of these, 86% or 4,078 patients had an ileal conduit, and then about 14% had a continent diversion, again, meaning neobladder or a different continent cutaneous pouch. They found that patients who underwent continent diversion were significantly younger and healthier. They were less likely to have diabetes, COPD, less likely to be malnourished, have bleeding disorders, less likely to have had prior pelvic radiation or pelvic surgery. And this kind of all fits, I think, with kind of how we think about selecting patients for continent diversions as compared to conduits. They found that neobladder patients were also more likely to receive chemotherapy before surgery. And I think, again, this is probably a reflection of those individuals being healthy enough and platinum eligible to kind of get neoadjuvant care. This figure is really the heart of this paper's findings. And so in this trusted cohort, with this well-curated population being made up of both individuals with ileal conduit and continent diversions, this figure shows the adjusted mean predicted probability of the study outcomes. And so the first one on their left here being postoperative complication, they found that individuals that had a continent diversion were 1.4-fold more likely to have a postoperative complication in the 30 days after surgery as compared to ileal conduit. They found they were about twice as likely to have an unplanned operation, and about 1.7-fold as likely to have some kind or some reason for readmission. And each of these were statistically significant. The most common reasons for readmission were septic shock, followed by urinary tract infection, surgical site infection, and then renal failure and wound disruption. The most commonly performed unplanned operation was just an XLAP. They didn't have kind of further detail than that. Next, they did not find any statistically significant difference in 30-day mortality between continent diversion and ileal conduit. The next was one of their secondary objectives. It was basically an attempt, I think, generate an easily kind of reportable outcome to help with patient counseling. And this was the likelihood of having any 30-day postoperative event, meaning a complication, an operation, or a readmission. And this was about 1.4-fold greater in the continent diversion subset than those with conduits. And then the very last outcome is whether or not patients had 3 or more postoperative complications. And this is a measure of, and this is, I think, my favorite term in Journal Club to date, super sufferers. And this is meant to mean patients who experience multiple complications and seem to kind of spiral in their early postoperative course. And they found that continent diversion patients were 2.1-fold more likely to experience 3 or more complications in the 30 days after surgery, and that their risk factors for being one of these super sufferers were increased age, having an increased BMI, diabetes, COPD, malnutrition, a longer operative time, prior pelvic surgery, and their bladder cancer pathologic stage. Interestingly, they actually found that a robotic approach for cystectomy was surprisingly protective against experiencing 3 or more complications and being a super sufferer. Their results were that patients getting open surgery were 2-fold as likely to have multiple complications. I'm not sure that this is a meaningful statistic or how to interpret it, honestly. Their conclusions then was that compared to an ileal conduit reconstruction, continent urinary diversion is associated with a greater likelihood of postoperative complications, unplanned operations, and all-cause readmissions to the hospital within 30 days after surgery. And some easy numbers to kind of take away from this research is that their work suggested about patients who have a continent diversion are about 40% more likely to have a complication compared to an ileal conduit, and they're about twice as likely to require readmission to the hospital. The bottom line then of this group's work was that that meta-analysis was probably wrong, that said they are kind of frankly equivalent in their rates of morbidity. they were right to say that they were correct to equal in their rates of mortality. And the bottom line at the end of the day is that, kind of as we know, patient selection and counseling is what's paramount to minimizing and predicting, I would say, adverse outcomes. The strengths of this study is that they did use a high quality national database, the NISQWeb dataset. Their criticisms, and these are their own criticisms, is that one, their CPT code for continent diversion doesn't discriminate between orthotopic neobladder and cutaneous pouches. I would argue that I think within this data set of people getting cystectomies in 2019 and 2020, the vast majority probably are getting neobladders. So I don't think that's diluting the data in a huge way. And then the kind of bigger criticism I would say is that they have no health-related quality of life metric to see if these probabilities that they're kind of reporting as their outcomes actually translate into a decreased quality of life or any difference quality of life between neobladders or continent diversions and ileal conduits. And with that, open it up for discussion.